Hello and welcome back. Today I have with me Miss Reema Chawla, who is a consultant plastic surgeon and has recently been through the journey of being appointed as a new consultant and an interview panel. So Reema has kindly agreed to give us some of her time and tell us about her experiences during the interview. So Reema, thank you for being here. Thank you for your time.
Well, no, thank you for inviting me. It's always a pleasure.
So let's jump into it, Reema. My first question is just to see right before we even get into the business of interviewing. Where were you in your training career when you first thought about applying for a consultant post?
So actually, it was very early on. I started my rotations in plastic surgery, and actually, every rotation, even as an SHO, I thought, is this somewhere I'd like to work as a consultant? And it was at my very first registrar post at the hospital that I'm currently working at that I thought, actually, I really like it here. It's really friendly. I actually not only get on with the members of staff in the department, but also in the wider circle. So in theatres, the the other specialties, I loved the coffee room, and I actually thought, you know what, this is somewhere that I want to come back and work. So actually, it's almost like I'm assessing each unit as I've rotated through, but that thought process started very early.
And then at what point did you actually think that was it just coming towards the end of CCT that you decided that, well, I should now apply for a consultant job? I mean, be it here, be it anywhere. That decision to switch from being a registrar to consultant, was there a particular switch or was that just part of natural progression of going through your CCT?
So actually, the honest answer was that in my ST3 and ST4 at the unit that I'm working in is when I actually started asking if I could come back and work there. So
Okay.
I very, very quickly decided that's where I wanted to work. And I kept in touch with various consultants from the department, and I possibly pestered them if they could make me a job or if there were any opportunities coming up.
Yeah,
So
so
yeah.
that's good. That actually brings us on to I was going to ask you a couple of things, but we'll do that at the end. So you said you were pestering people already for the consultant jobs, and when did you actually really start preparing for so you applied for the job, you got shortlisted. Was that when you seriously started preparing for the interview?
So the formal interview practice. So I'm currently a substantive in a job that I was in a locum for about a year and a half. I did some preparation before the locum interview, but because it was a locum interview without the big sort of, 10-person panel, I don't feel that I prepared as well as I could have done for that locum position. And the real interview practice started probably about 6 months before the actual interview itself.
6 months before the actual substantive interview
Substantive
panel.
interview. Yeah.
Okay. And so that is quite a long time because I used to think that people usually start like once they've had the shortlisting is when people start doing it. So in your experience, have you seen other people do that as well, like your colleagues? Or were you just quite switched on about it?
I wanted to perform well in the interview. I didn't start any practice or anything like that, but what I was doing was gathering documents that I needed to read. So, for example, like trust-based documents, looking at the videos of board meetings, making sure I had those links available, and maybe summarizing those meetings. Sometimes interview preparation, particularly if it's not a clinical interview, can be quite tedious and quite long-winded. So I fully appreciated that actually it's not something I could cram in a short period of time. So I did start quite early, but it was very sort of, an easy start. So maybe an
So you
hour a week.
mentioned hour a week, okay. And you mentioned board documents and other trust documents. Any other resources that you used, like courses, books, podcasts? Was there anything in particular that you used at the time?
Yeah, so the ISC medical course for interview preparation, I actually did that before the locum interview. I thought it was a really
Okay.
fantastic course. It was good foundation to what the interview was about, how to structure answers and things like that. And I took notes from the course and then I referred back to the notes when I started the preparation for the substantive interview. And then there was also a white book that has been with me sort of throughout my training, I think also from ISC Medical. So on a very similar note, but they had lots of examples in that book. So those are the two formal resources that I used for
So lots of
preparation.
things you've said there that really interest me. Tell me about this white book, because one of the things that I often say to residents is throughout your career as a registrar, at least, what you need to do is keep a log of things that happen around you, because come interview time, it's a very good reference to go back to pick up on those examples, and then you're able to talk about those examples. So you're saying you've kept that sort of a log from very early on in your career?
So the white book is actually, it's a book that gives questions and answers with examples. So not my examples. I found it quite challenging to find the examples, and I think your advice about keeping a log is really, really good, particularly if there's any challenging days, because actually by the time it comes to interview, I almost had the question of, I don't think I have enough examples. Or I don't think I have any examples of this. So
So
yeah, I think
what
that's a really good
examples
idea.
does the why is this something which is published by somebody?
Yeah, so I think it's published by ISC Medical,
Hmm.
and for each question that they ask, they also then give examples with references to sort of like a fake doctor. So, for example, they'll say, I demonstrated leadership when I led a ward round when I was doing acute medicine. So then lots of different examples from different specialties.
Right, I see. Okay. Okay, fair enough. So ISC Medical provided you with some information.
Hmm.
A big section I had was how you gathered information for the interview. So, did you go into actually go back to the trust documents? What did you find out from the trust documents about watching the board meetings and reading the trust documents? What did you read? Did it help you in the end? What did you learn?
So, for example, watching the board meeting, that was, looking at things where there's, non-executive director, there's a chief executive, priorities for the trust, things that, as a clinician may never really be considering. They also summarize things like finances, what they're looking forward to for the next upcoming financial year.
I've often wondered whether the trust documents, things like the board meetings, attending them, reading the CQC reports, documents like that, are they any use in an interview? I've seen them come up every now and then, and I get asked this question whether, how much depth should they be read into? So I asked Reema about what she'd done, and she came up with something interesting about the CQC documents for the trust. Watch what she says.
With regards to the trust documents, I think one of the important ones was the CQC document. So with regards to the CQC document, it's showing with evidence where the trust performed well and what could improve. And I think that was a good reflection of, where I could suggest that the trust or the department do better in order to support improvement where improvement is needed.
So, did you actually use this stuff in the interview? And was there any
Yeah.
examples where you actually could quote some of this?
Yeah, so particularly with the CQC documents. So for example, the time to see patients in A&E was possibly a bit longer, needed improvement, and then where that could be improved. And with regard to plastic surgery, for example, streamlining pathways so that patients who didn't necessarily need it to be seen on the day could be seen in an appropriate clinic in an appropriate frame of time. So making suggestions to streamline those pathways is something that I suggested in one of my interview preparation answers. So actually
And you
reading the
referenced it
documents
back
was
to
useful.
the. Hmm,
Yeah, reference it back to the CQC report because actually
yeah.
I think it almost seemed as if the people in the interview wanted to know that I knew what was going on with the trust so that I could contribute if and when I became a consultant there.
That was a CQC report, which is obviously useful. But what about other documents? Things like the NHS Ten-Year Plan, things like the Baroness Amos report or the Ockenden report. Do they need to be read? Let's see what Rima had to say about that.
Itself. But yeah, I read the 10-year plan. I quoted that in my actual interview. And actually, I tried to quote as many documents as possible in the interview without going overboard, but mostly to sound relevant. So, for example, one of the examples in the 10-year plan is to go digital. And I think that's
Yeah.
relevant to all our practices. Things like prevention, which may not be so relevant for, say, hand surgery, but anything that I could find that was relevant, I did want to reference in the actual interview itself.
And you took pains to make points and make notes, I guess, to remember all of them. And then when you were reading things like the NHS Ten-Year Plan, which is a huge document, and other such documents, how did you read that? Did you actually read through it, underlining things? Did you use AI to summarize it? What was your, how much time did you spend on it? What strategies did you take to summarize it, basically?
So what I found with the majority of the documents, the first couple of pages had a good summary, number one. The second bit of advice that I was given from one of my colleagues who just got their job was to use AI to summarize those documents. And that's something that I'd never done before, but actually I found that incredibly useful.
So would
And
you
I
use
did that.
ChatGPT?
ChatGPT, I'm quite an AI novice, so ChatGPT was the one that I knew and the one that I used, and it worked.
So going a little bit deeper into these
Hmm.
documents. So obviously these documents give you the information on what the government's direction is, what they want for the wider NHS. Did anyone suggest, or did it occur to you at any point that reading these documents, and I'm sure you yourself must have had some thoughts and ideas or opinions about, are these useful? Are they good? Are they just silly? Are they overtly ambitious? Did you think about that, and did you get a chance to express that in the interview, or did you not express it in the interview because it felt like it would be way too much out there?
So I did think it was a lot to read. There are lots of documents that people suggest you read, even including the ISC medical course. In that course, they do give a little summary of some of those documents and some of the recent reports that have been written. I think it's important to know sort of the overall summary. Some of those documents I would agree are a bit long and tedious, but no, I didn't feed that back in the actual interview itself. Because actually what I wanted to do in the interview itself was sell myself, what I've done, why I think I'd be a good colleague.
So do you think that takes up more of the interview than knowing about these documents?
But yeah, I think the aim of that interview for myself was, how can I demonstrate that I'd be a good colleague to work with? So there were obviously a few people in the interview that knew me because I've been working in the department as a locum, but obviously there's many in consultant interviews where you don't know anyone really. And in that situation, I think you really want to show that, you have been a good colleague by giving examples of, times that you'd worked at other units and that you can be a good colleague in terms of managing the department. I think management was actually something that I really learned quite a lot about in this interview process. And it sort of
Yeah,
really
we'll we'll
changed my
we'll
thought
we'll go a
process.
bit we'll go a bit deeper into management and learning in a sec. Leadership and management.
Sure.
One final question on the NHS documents and stuff.
Yeah.
Let's say someone's got an interview next week or in
Yeah.
3 or 4 days' time, right? And they haven't spent too much time going through these documents. Do you think they'll lose out on a lot, or they're stressing about it if they didn't bother to read in detail? Or what would your advice be? So if you had turned up without reading any of those documents, would it have made a difference to the quality of your interview or to the outcome?
Probably not, although I did quote the NHS Ten-Year Plan because that's a really simple document to summarize because there's only three main objectives. So it's from analog to digital, from prevention to cure, and one other really easy, something to summarize. And then I also referenced GIRFT, so getting it right first time, because I thought that was really relevant to plastic surgery and what I had achieved. But actually, I referenced it because it could reinforce what I had achieved for years.
Okay, cool. So let's move on to the pre-interview visits.
Yeah.
So pre-interview visits, were they useful?
They were incredibly useful, actually. They were good in terms of putting me in a situation with someone who will be judging my performance in the interview. So it got a little bit of that, anxiety up of performance. It was almost like it felt like to me like mini interviews. And in some of them, the people that I met, they spoke for a majority of that meeting. So the meetings on average lasted between half an hour and an hour with each person.
Each
So some of,
pre-interview meeting lasted half an hour to an hour.
yeah.
Wow. Okay, that's impressive. Okay, sorry, carry on.
Maybe a reflection on me rather than on them. So there was what, and I did think, that everyone's priorities are very, very different. The priorities that I could sort of see and understand were the surgical ones. So the ones with the consultants that I met in the department, those felt, I can understand those. They're very straightforward. I could have, said those sort of priorities for the department myself. But the priorities, say, the medical director, the chief executive, very different. And actually, to get their perspective on things was very useful because it got me thinking in more of a management mindset. So the medical director's priorities for a new consultant in the trust is very different to the clinical director of a department. And I really appreciated that in those conversations and where I needed to focus my reading and my preparation. I asked to meet the non-executive director who was chairing the interview, and I had been told that actually the non-executive directors don't often want to meet, but she
Hmm.
happily agreed to meet. And it was a nice conversation, but it was very short, very concise, and actually it did give me some clues about what she or the other panel members might be asking at the interview.
So what do you think is the difference in the expectations of a chief exec of a new consultant? What's the difference between what they expect versus what a clinical director expects, or what you think you are brought up to expect as a trainee?
So, with regards to the chief executive, I think their priorities are slightly more financial, and growth, and wanting the consultants to participate in the wider community of the hospital. So, for example, the hospital that I'm working in has become a teaching trust. So, making sure that consultants are able to fit into those roles so that they're not left empty and actually it can continue to maintain that role as a teaching trust. As a trainee, I thought, be a good surgeon, be a good clinician, be able to lead in a theatre, be able to lead in the department, and less so maybe about leading on change. Whereas to the higher management, it felt like it was more about leading on change and leading with a financial basis in mind.
And did you go prepared with any questions to ask them?
I did. So I asked pretty much everyone, including the non-executive director, what their priorities were for a new consultant in the trust. And actually, that was my opening question. And probably that triggered about 5 to 10 minutes of conversation about what they're looking for. So in that conversation, I was able to sort of get clues about where I needed to prepare my answers, but also useful for sort of long term. What is expected of me as a consultant in the hospital rather than just in the department.
I think that's an excellent question to ask, actually, about what your expectations are from a new consultant. That's a very good question to ask. So let's move on to your actual interview day. I'm guessing you arrived on time and someone welcomed you in, etc., etc. Did you have to make a presentation?
I didn't have to make a presentation, thankfully.
Okay. So tell us how the flow of the interview was. Who was in your interview panel and what was the flow of questions like?
So it was a round table, which made it feel more comfortable and less threatening than a long, long, wide table, which I expected. And there was a non-executive director who chaired the interview. There was an external interviewer who tuned in via MS Teams, and they were a consultant from another hospital, so plastic surgery consultant. There was a medical director, the chief executive, the clinical director of the department, one of the other plastic surgeons, who's a hand surgeon, which is a specialty that I work in, and also a surgeon from another department who was an orthopedic surgeon, which was relevant again to the job that I'd applied for.
So what was the opening question was, I'm guessing the non-exec introduced themselves and then
Yeah,
they hand over to the college rep, the external consultant, who normally opens with why you're suitable for the job. Is that what you got asked?
yeah. So I think she had said, welcome to the interview. She wanted to introduce herself again and also encouraged everyone else to introduce themselves, which was quite entertaining for me because obviously quite a few of them I'd known for over 7 or 8 years, but they still introduced themselves anyway. And then the interviewer who was the college rep, he actually just asked about one of the jobs that I'd had listed on my CV. So the previous job that I'd had was an honorary consultant in another hospital, and he just asked what that meant
Okay.
and what that involved. And so I was expecting a sort of tell me about yourself, I had prepared for a 5-minute answer on my whole background, why I was there, what had led me to that point, but actually it was just one simple question, which was quite a nice way to start the interview.
Okay, that's slightly unorthodox, but I suppose that's a good way of breaking the ice. So
interesting to hear Rima's next question, which was, what was your biggest challenge as a locum consultant? Now, I have it on good authority that she fared really well in the interview. I've spoken to people who sat on that interview panel, and they've told me that Reema interviewed really well. Even a candidate like that it's tempting to say things that are generalized, and it brings us back to the point that examples will always stand out. And in fact, I sort of started talking about that during the interview, so you'll hear that bit as well. But in answer to that question, what was the biggest challenge you faced as a locum consultant? Reema started explaining that stress is an underlying factor for everything, and therefore she tried to focus it on stress, on managing her well-being, out of work, during work, etc. She got brought back to talk about a concrete example. So, and I've done a bit of explanation afterwards as well. So watch what she says.
do you remember what the next question was after that?
Yeah, the next question was from one of the plastic surgeons who'd asked me what my biggest challenge had been over the past year and a half as a locum consultant. And I
Okay.
think it was important that I gave examples about the challenges that I'd had and the reflections that I'd taken away from them and where that had led in my personal and professional growth.
Can you tell us what you answered? Or if you prefer not to, that's fine. But
Yeah, of course. So the way that I answered that, so initially the way that I'd answered, and I don't think that that's how he wanted me to answer. I said that with every challenge, the common thread is stress. And therefore, my approach to the very challenging year that I'd had was actually stress management. And the way that I'd managed my stress was both in work and out of work. And in work, that it involved me being very organized, making lists, delegating appropriately, planning my theatres, planning my clinics, making sure I was reading ahead. And then out of work, making sure I had a good work-life balance. I did talk about the things that I do out of work to make sure that I'm grounded and I'm processing emotions and difficult days, so things like meditation and yoga. But actually, what they wanted, they really wanted an example about what the challenge was. I thought that my first answer was a reasonable answer because I do believe that, with every challenge, the thing that you need to manage is yourself and stress, right? And he specifically wanted to know what the most challenging thing was. And actually, I did have, a series of challenges. So then I ended up picking one. The one that I'd picked was a challenging patient, challenging communication, because I'd been referred a patient for a second opinion. And I felt at the time that was quite early on in my career to be giving a second opinion as a consultant that was 4 months in. But I took the opportunity on. I did my best. I prepared by making sure that I spoke to colleagues outside of work in other hospitals. I started again, basically. This is a patient to pals, to the local MP. So a very challenging mother and daughter combination to start off with. But actually, realizing that I took a back seat, I started again from the beginning and treated them just like any other patient. And also made a management plan, which I felt was very appropriate. And then finally communicating that verbally, making sure I had a chaperone in the room, which meant that I felt safe, but also so the family felt safe. And then again, making sure that I was communicating with the family on a regular basis so that they knew that, number one, they hadn't been forgotten, and number two, that they were being looked after. So at the time, that probably was quite challenging for me with regards to the stress in the lead up to that situation, in the stress during, and the potential of, no, they're probably going to complain about me next. So yeah, I think that was probably
so
one of the,
can I
yeah.
tell you my take on this whole interaction for
Yeah,
this question
sure.
number 2. So I can see where your clinical director was coming from, because your first answer was a bit too generalized and didn't really say too much about you. I mean, it said that, okay, I'm someone who can deal with stress and I have ways and means outside of work where I'm aware of my own mental health and I have ways to relax. But I think the reason you got pushed was because, and I think that was a blessing in disguise for you, because that really comes out in, when you tell us about that challenging patient you had to deal with at the mother-daughter combination, you ended up telling us a lot of things about yourself, which was your problem-solving ability, your whole thought process about, second guessing your own ability as being a new consultant, but being asked for a second opinion, then communicating it back. I mean, it just showed them so much about you. So I think that was a very, very good move to push you to answer that. So that's what my take on it is, and that's probably why, as we were saying earlier, the concrete examples stand out far more than saying something like stress is an underlying factor, and therefore I'll deal with stress. So yeah, no, I think in the end it was a very good answer.
This is another example of an excellent answer. The question this time was about developing a new service, and Reema gave the panel examples of what she'd done in the past, including things like stakeholder engagement, referral pathways, governance, MDT working. She's done some external benchmarking, or at least she's spoken about the specific things that needed to be done. And this included a visit to external centers. Because you're a new consultant developing a new service, there's a lot of engagement with outside help or outside experts. And I think as she says, she perceived that the panel interviewed her, the panel saw her in very good light from this. Now, the important thing to take away here is to talk about specifics and not generalities. And most of the times, it's a question of thinking through the logistics, because you will have done something or the other in that area. If you're applying for that particular role, clearly it is your area of interest and you're expected to figure out. I mean, just think along the lines of the flow of the patient, from first contact with the service to what their eventual outcome is going to be, and just think about what you can do to address it, and just draw upon anything you've done in the past in that particular area. Let's listen to what she says.
So that was one of the hand consultants. Then next went the orthopedic consultant, who asked me how I would go about setting up a peripheral nerve unit. So my job role was advertised as a plastic surgeon with interest in hand and peripheral nerve. So thankfully, with that question, I mentioned that I'd actually already begun setting up a peripheral nerve unit, and I spoke about how I'd started to do that. So by identifying appropriate patients, by making sure that I was getting appropriate referrals from my orthopedic colleagues within the hospital, by setting up an MDT with our therapists, making sure that patients were getting appropriate postoperative management. I said that I'd also joined a national MDT. That the difficulty of setting something up new, especially as a new consultant, where there's sort of no real support within the hospital, is that you want to make sure that you're doing the right thing for the patient, and that you've got someone experienced in that field that you can ask questions to. And I think an MDT in another hospital is a perfect way to do that. So then I mentioned this national MDT that I joined, and actually that I would, for future, go and visit this hospital to see how their MDT worked within the hospital, and then bring that into my department to see what mistakes they'd made and how I could avoid that.
And did they like your answer?
They did. Yeah, I think there was, I mean, you're reading the room and you're like, okay, I've spoken enough now. I think my answer was about 3 minutes, and I think they like that answer.
Yeah. Okay.
So Reema's next question was what the challenges for the department are, and here, listen carefully to what she says here, because she got asked about the departmental challenges, and in describing those, she tells you where she gets her information from, but also tells you, or the panel at the time, what she's done already in starting to solve those problems. And this is the sort of thing that you need to do in the interviews. Is any question You want to drop in little hints or sometimes big hints about the things that you've already done, either in that place if you're already working there or in your previous hospital, to solve those kind of problems. So you're telling them about their experience and how you're going to be an asset to them going.
What next?
What next was from the CD of plastic surgery, who asked what I saw the challenges of the department over the next 5 years. So I had prepared this answer mostly by speaking to the manager for the department and the division. I actually had asked him what he felt the challenges were, and that gave a really good foundation to this answer. So essentially, I started off with an opening sentence of, there are a few challenges. For example, increasing number of patients, particularly elderly patients, so patients presenting with skin cancer, the hand trauma and elective hand surgery. And then I then focused on how I could make suggestions to improve skin cancer, to improve the hand trauma and the elective hand pathways. And also I'd mentioned ways that I already had initiated making a change with that. So, for example, with hand surgery, I have shortened the waiting list for patients presenting with Dupuytren's contracture by setting up a one-stop clinic. So then I spoke about the one-stop clinic, and also I identified a room that we could set up an image intensifier in, which would reduce referrals to our radiology colleagues potentially, and also by obtaining an ultrasound machine again, meaning that we could do point of care diagnostics, which again would reduce pressure on other departments in the hospital. And also it meant that patients would be seen and sorted out a lot sooner. So
So
overall,
this
I feel like
answer,
yeah.
this answer you had kind of prepared before, so that's good. You had some idea of the question that was about to come and the contents of it. For all of the other answers, was there, like you said, you had the opening line prepared. Did you have opening lines prepared for any of the other expected questions?
I think in the opening line, I tried my best to summarize what I thought the important points of that question were. So even if I hadn't prepared an opening line for an answer, I very quickly tried to think, actually, what are they looking for?
And did you use a particular format, like they teach you to follow a star structure and those sort of acronyms?
Yeah. So when it came to questions with clinical examples, I did use that star structure, SPI. I think there's a couple of others, and they're very, very good for the clinical examples. But when solely speaking about, the management and, the things that I could do to improve and change and, how can I change this and how can I be a good leader? That's when I think the structure was really necessary. So structuring those answers and then maybe adding star in if I'm talking about a specific situation.
Cool. So what next then? After the next 5-year plan, what was the questions after that? So now you've got the medical director, chief exec, and the NED to ask you questions, and they're the people who ask you the more tricky questions.
Yes, I noticed that. So the medical director asked me what I thought about equality, diversity, and inclusivity. And again, another question that I had prepared, and I related it back to plastic surgery, particularly with regards to teaching, using slides with sort of patients from every background, making sure that our trainees and juniors know that it's not just Caucasian skin that gets skin cancer. I think that answer was quite well received, but also speaking about the fact that I've trained doctors from other countries, try to identify where the gaps in their training programs are. So, for example, we're very paperwork heavy in this country. And actually, although colleagues from other countries have excellent surgical skills, excellent clinical ability, it's also always the paperwork, I think, that they can sort of fall back on. So actually guiding them through that is another way to address that EDI and making sure that everyone feels like they're able to do a good job.
So with EDI, just because it interests me quite a lot as well, what did you just sit down with yourself, brainstorm a little bit, think about these things, or did you go to any particular resources? So for example, when people send emails, they put their pronouns there, and often there's a link there which says why are pronouns important, and I'd always see that link and not think too much about it until one day I was curious and I just clicked on that link, and there's a whole website telling you why pronouns are important and takes you into further into that. So there's a lot of reading resources for other prospective candidates, but just wanting to understand what your thought process was and how you reached these examples.
So actually, it was brainstorming with a colleague. So actually, the thing that I found extremely useful was sitting with my colleague who just got his substantive consultant post, having sort of, throwing ideas out about where actually in my life do I address equality, diversity, inclusivity, and having examples for each of those. And I think the example of the international doctor is, I think, one that we can all relate to, because there's many doctors coming from abroad that are excellent surgeons and excellent clinicians, but actually, I think all of us have probably had to support them in different ways. And then, for example, like the one with regards to teaching. So that's something that was quite personal to me, because from an Indian background, it's not often common that people have skin cancer. But my granddad's been diagnosed with skin cancer a couple of times. He's very fair-skinned, but he is Indian of heritage and looks very Indian. And he really struggled to so when he went to his GP didn't believe him. She said it was nothing. And even when I sent him to a colleague. Even my colleague, I could see the doubt in my colleague's mind, but I was extremely insistent that I do truly believe that this is skin cancer, and I really felt strongly that a biopsy was necessary. That was something that was actually very, sort of very close to me, because I thought, as an Indian patient of very slightly darker skin color, if I wasn't his granddaughter, he may have just been left and not treated. And, he's an Indian patient who's been on, holidays abroad, had sun exposure, suntan, sunburn. And for that to have been dismissed just because of his heritage, I think, that felt quite upsetting to me. So actually, it was mostly examples from real life.
So did you tell them your grandfather's story as well?
I didn't, because I thought I wanted to speak about as much as possible. I spoke about my grandfather's story to the Ned when I had my pre-interview meeting with her.
Right, okay, yeah.
I feel like I could have mentioned that in the actual interview, because it's quite nice to bring a personal story in. But I think the answer was probably sufficient.
Yeah, no,
but
it
less
was,
less
definitely.
emotive. Yeah.
So that leaves two more questions, I think. Unless there were
I
more,
think the
but
medical director had two questions. So the medical director also asked how I could approach reducing the wait for A&E. And not only that, but also making sure that referrals aren't rejected. And, there is often a bit of
yeah,
confusion.
that
Yeah,
is a
there's a bit
pet
of,
peeve going around, yes.
so
Okay.
sometimes there's a bit of confusion between, what kind of leg laceration plastics take and which ones they don't. So that example was brought into the actual interview, and I thought that was quite a challenging example. How could I absolutely ensure that referrals are accepted?
So if there was something which was, medical director says that this is actually a plastics case, and quite obviously it's not. We're just exploring how could one approach that kind of situation. I'm guessing it wasn't that kind of a situation, but what if it were? How far would you have pushed it?
I mean, I did mention I thought that, having been a resident fairly recently myself, it's always important to sort of remove any doubt whether the patient is appropriate to accept. And at the end of the day, there is a patient at the end, in A&E that needs to be seen and treated. And if it's just a quick, yes, I don't think this is appropriate for us, I think it would be better managed by another specialty, I think that's always okay to do, rather than just rejecting it from the outset, because sometimes you don't get the whole story. And also, plastic surgery as a specialty is one where other specialties will often go to when they're having difficulties. So, the cultural and the mindset of plastic surgery is, yes, we can take it. We'll try our best to sort it out. And that's something that I have been raised with. But I agree, not everything is suitable. And I think if it's just a simple conversation to say, no, I think someone else should take it.
Fair enough. Okay. What next?
What next was the Ned. She asked me about the trust values and which of those I resonated most with. And she also repeated the trust values, which are include, respect, and improve. And I then, again, thankfully had prepared this question somehow by chance. So although including everyone and respecting everyone is something that I prioritize in my daily life and the way that I behave and act. Improvement was something that I really, really was passionate about and actually really wanted to talk about because I'd made so many changes over the previous year and a half as a locum consultant. I really wanted to speak about all of them. So I managed to speak about maybe 3 of them, but I was really gutted that I wasn't able to speak about one of them, which actually increased the trust capacity to see patients by 25% because I created a new clinic room. So that was one of them. I started a one-stop clinic, which was another. I set up teaching for our residents, which was another method of improvement. And I think, again, that was a nice answer because I was able to mention all the things that I'd implemented, but also how it matched with the trust value.
I think that was a very good use of the, just shows you how you can include something as simple as trust values to actually talk about yourself. I mean, not talk about yourself in a bad way, but
Essentially.
just show the panel that if they added you onto their department or hospital, you'd come across as a very valuable asset, basically. But
Yeah.
it's turning these things around, and I think that's the purpose of these questions, because no one really wants to hear just generic crap about I'm all inclusive and I believe in improvement. I mean, you gave them concrete examples, so that's really good. So
Yeah.
was that it, or was there any more?
Well, she made a comment also. She said, had I publicized my one-stop clinic on the trust website and the sort of daily newsletter. So obviously that was good feedback to me that, she thought it was worthy of publicizing, which obviously I hadn't thought about. And that was the only question from her. And then I had a couple of questions from the chief executive. And one of those questions, I think, was tell him about a mistake that I'd made. So again, another question that I had prepared. So it was a positive for me. And I chose a mistake that I'd made early on in my career. I chose a very sort of low risk mistake, and actually one that probably wouldn't have caused any harm to the patient, but significant enough that it was a lesson that needed to be learned.
Did you just play it safe?
No, it was a genuine mistake. So the mistake that I had made, I was my first plastic surgery job. The consultant had done a reconstruction on the patient's back after they'd had developed a pressure sore, and she was really hungry. She really needed to go to the toilet. Basically, really needed to leave the theatre. So she asked me if I could transfer the patient. So I was obviously brand new, and yes, technically I'd done my manual handling. I could transfer a patient, but I'd never transferred a patient from prone to supine before. But actually, I felt safe enough because there were about 5 or 6 people in theatre with me. So I thought, yeah, there's so many people here. They all seem quite comfortable. I'll help transferring the patient. And as I was transferring the patient, I hadn't paid attention to the drain, and then the drain came out. So she was obviously extremely upset. The drain obviously is there in case there's any collection, hematoma, seroma, or anything like that. But actually, we kept a good eye on the patient, presented it, taught my junior colleagues about it, made sure that any time I transferred a patient that the drain was being looked at. And actually what I did say was that my personal reflection on that, if I didn't know how to do something or I didn't know what I didn't know, just to ask or to say, I've never done this before. And then the chief executive then decided to ask me another question, although I think he said that his questions are up. He said, well, how do you balance saying where you don't know something and just sort of carrying on? Because he said, I'm sure, you don't always want to say, oh, I don't know this and I don't know that, because you don't want to look stupid. But actually, in the job that we do, where it's all about patient safety, I thought, I prioritize patient safety. If I didn't know something and it was important to keep the patient safe, I would speak up, and that's something that I still continue to do, even if it's silly. If I didn't know where something went, if I didn't know how to use something, I'd do my best to speak up rather than just sort of keep going. Because at the end of the day, there's a real patient that's in front of you, and you don't want to make a mistake on a patient. So learn from the lessons of others rather than making the mistakes of yourself.
That's great. So all your answers seemed quite impressive to me.
Thanks.
What do you think was your worst answer or weakest answer?
Probably the one relating to the A&E, the A&E bit. How could I make sure that all the patients are seen? And I mean that I was thinking out loud with that answer because it was completely unexpected. There's a fight between, plastic surgery and orthopedics and sort of, yeah. He said, how do you manage that when they're arguing about who takes what? So it was a very specific but generic question that I hadn't really prepared, and I hadn't thought about how can I approach that? And I hadn't come across any questions of that style in my preparation. So probably that one.
So that would fall under the conflict category, I guess, because but I'm guessing you had your own example for conflict prepared.
I did, but I think I didn't feel like it was a conflict question because I felt like it was, please make sure that you all see the patient and you just accept the patient. And how can I ensure that you see the patient rather than you're having an argument with your colleague?
I think that is probably coming from a current issue is what my interpretation of that is. Okay, now that's great. We touched upon leadership and management briefly earlier.
Yeah.
And I said we'll come back to it. So leadership and management, you said you learned a fair bit in the preparation process for the interview. But as the good thing was you'd done a year as a locum, more than a year as a locum, for a typical ST7, ST6, ST8. Do you think it'd be quite difficult for them to find examples of where they've demonstrated leadership and management? And what was your own personal experience of that?
So with regards to leadership, I think I had plenty of clinical examples of leadership throughout my training and that I could identify from quite early on, actually. As a surgeon, you're leading brief, you're leading in theatre from very early on. And I think that's a good enough example for leadership. With regards to management, I think that's probably more challenging. So unless, you've done rota management or anything like that, probably a lot harder to speak about the management skills that you had developed in training. And certainly
But
I
you
couldn't
had management skills, though, didn't you?
I did, and I think but the management skills that I spoke about were the ones that I had. So, for example, I set up that one-stop clinic, which was very much, I thought it was a very good example for management because it involving lots of different people. It involved finances, and I thought it was a very consultant sort of level question. Whereas, there are obviously examples of management in your training, managing people all the time. And I guess you could extrapolate that to a consultant interview, but I think a lot harder to do.
Yeah, cool. So we're getting to the end of the interview. I've got a few very quick rapid fire type questions.
Sure.
So question one is one thing to start 6 months before the interview. This is for future candidates, other candidates. What would you advise? Is one thing to start doing 6 months before the interview?
Thinking about examples.
Thinking about examples. Yeah, that's a great one. One document every candidate should read.
The CQC report.
For that trust.
For that trust.
Hopefully. Yeah.
Hopefully. Not just generally.
One person they should speak to?
Someone who's recently got a job there.
Yeah, I guessed that answer. I guessed you're going to answer that. One interview mistake that you repeatedly made. You can say if you didn't make any.
No, of course I did. Interview mistake or interview preparation mistake?
Either or. Well, give us both.
Okay, so interview preparation mistake was not speaking out loud, and interview mistake, not pausing for long enough before being given the question that I hadn't prepared.
Okay. One thing that you think candidates over-prepare.
Reading all those documents.
Okay. One thing candidates under-prepare.
Practicing with someone who's been through it.
Okay. This one might be a bit tricky. One piece of advice you ignored but later realized was right.
So I also ignored the advice that I just gave, was not to practice out loud. So do practice out loud. Practice with someone who's been through it, who's kind enough to coach you.
And final question, if your interview was next Monday, what would you do these next few days?
Think about all the examples of where I've demonstrated leadership and management. And yeah, so just think about loads of examples and then structure them.
So that's the end of these questions. But what piqued my curiosity was you said that you didn't practice out loud enough, and that's one of your main suggestions. It sounds to me like your interview went quite well, obviously, and you did get the job, so it must have gone well. What were you missing by not practicing out loud? How would that have helped you?
By not practicing out loud or practicing out?
No, by practicing out loud prior to the interview, in the preparation, you said that was one of the things that candidates should do.
Yeah, definitely.
So what would you have gained additionally, or what is it that you're missing that you would have got had you practiced out loud?
Oh, I did. So I think the biggest transformation in my interview capability, technique, and my answers, that changed when I started practicing out loud. And I really didn't want to do it. I did do it, and that's only when it changed, and that's when I was able to feel confident. But I say practice out loud with a caveat. Practice out loud with someone who's kind enough to give you some kind feedback.
And how did you do it with more than one person, and how many sessions did you do with whichever person?
So I did it with 2 people, and I had 3 sessions with the recently appointed candidate, and I had probably 3 sessions with someone who is also applying for a job in a similar specialty.
Okay, so a fair amount of practice then, about 6 to 7 sessions. That makes sense.
Yeah, 6 or 7 sessions overall, and then by the last session in both, I think there was quite a significant improvement and a significant increase in my confidence also.
Yeah, no, I can identify with that actually. Yeah. Great. Reema, thank you very much indeed. It's been very, very useful. I'm sure candidates will find it useful. I personally found it very useful, and it was quite insightful for me as well. And I'm sure the next time I'm on either side of the panel, I'm going to use some of your techniques.
Do you have another interview to go to?
What, to interview somebody else or be interviewed myself?
No, be interviewed.
Be interviewed. Well, I try and get into spots where I get interviewed just to get the practice.
Okay, fair enough.
For
I'm
fun.
glad you
Well,
learned
I don't
from
know.
it
I don't
too.
know if I'm serious about it or not. But yeah, every now and then I just dabble in it to see if I can get some free practice out of it. And if I get the job, that's a bonus.
Of course it is. Well, thank you for having me. It's been a pleasure.
No, thank you very much indeed. See ya.
Bye.